My name is Dr. Scuderi. I am a naturopathic physician here in Scottsdale, and today I just wanted to discuss a little bit about one of my favorite techniques called Fascial Counterstrain. I want to explain what this treatment is, why we're using it, because it's very different from most hands-on therapies people are used to. So what is fascia? Fascia is a connective tissue, simplistically, that wraps around everything in your body. So muscles, nerves, the blood vessels, organs, and even the brain and spinal cord. It's not just packing material. Fascia is alive, it's sensory, it's highly connected to your nervous system. It is absolutely not inert. When fascia is healthy, it's elastic, well hydrated, and allows tissues to glide and communicate normally. When it becomes irritated or inflamed, often after injury, surgery, illness, stress, or chronic overuse, it can stiffen, compress nerves and blood vessels, and continuously send danger signals to the brain. My favorite thing to address this is fascial counterstrain. It's a very gentle, precise manual therapy technique designed to help your body turn off those stubborn pain signals and ongoing inflammatory signals. Fascial counterstrain evolved from an older osteopathic technique, so a DO technique called strain and counterstrain. Over the past 20 or so years, this work has expanded into what's called fascial counterstrain. The big difference is this: fascial counterstrain doesn't just treat muscles and joints, it evaluates and treats the entire fascial system. A lot of chronic pain isn't coming from structural damage anymore. It's coming from a number of things, but one of them being persistent inflammation in nervous system hypersensitivity. So after an injury, surgery, immune response, whatever, inflammatory chemicals can become trapped in fascia and small lymphatic channels. That keeps pain receptors turned on and will sensitize the spinal cord and brain over time. So that's why pain can spread and change locations and feel out of proportion from what imaging shows, and why scans often look normal even when you don't feel normal. Another sort of distinction is that this technique is an indirect technique. So most hands-on treatments today are direct techniques. That means pushing, stretching, cracking, forcing tissues where they don't want to go. Fascial counterstrain is an indirect technique. So instead of pushing into resistance, we gently position tissues in the direction they already prefer. The position of ease, they call it. So this slackens the irritated tissue and allows inflammation to drain from that area. What this does physiologically is that it reduces protective muscle guarding, improves blood flow and lymphatic drainage, decreases inflammatory chemicals in the tissue, calms the nervous system. All of these things it does. So in simple terms, we stop arguing with the body and we let it reset. During the exam, you're doing a diagnostic process and feeling your spine and checking specific tender points. So tender points are very small, precise spots that reflect irritation in deeper tissues, such as nerve, blood vessels, everything I talked about. They're not random. Each one corresponds to a specific anatomical structure that's huge. To understand this, there's a concept called convergence. For example, a small vein near the spinal cord becomes inflamed, the fascia around it will tighten, and that irritation and inflammation will feed back to the spinal cord, and the nervous system can then project that irritation out to a specific patch of skin, because that patch of skin and that blood vessel are innervated by similar branches. So a common example is the upper trap first rib area. So you can massage it, cup it, needle it, but if that deeper structure isn't addressed, pain might persist. What this treatment feels like is very gentle. There's no cracking or aggressive pressure. There's no stretching or overstretching. Just positioning you in a very specific way, and we hold it and allow your nervous system, inflammation to drain, and your nervous system to recalibrate. So most positions are held for about 30 to 45 seconds. People often feel warmth, softening, a sense of relief, deeper breathing, or just feeling like the body's like really letting go. It can actually treat things and help people who might not have had benefit from other therapies in the past. So physical therapy, medication, surgery, and even injections. That's because these things, although they're great, they don't always address inflammation that's trapped in the fascial lymphatic system, which is an important picture when it comes to nervous system hyperactivity and persistent pain. And fascial counterstrain is designed specifically to address this problem.